Yes, Rahul, we are live. You can start.
Good evening, viewers. My name is Rahul Desai, and on behalf of MedTalks and FDC, I hereby welcome you all to today's module. Dear viewers, today's module is a very important topic, which is very crucial in our day to day aspects, not only for a common man, but also those suffering from diabetes. Water is very essential for mental and physical well being. But how many are aware that water is very crucial in diabetic people also? It is very few. And therefore, today's module forms a very important milestone in our journey of 52 weeks with Diabetes Essentials. So, before I hand over the platform to Dr. Kalra sir, let me have the opportunity of announcing the names of those doctors who have answered the quiz questions correctly in the last episode. And the names are Pratik, let me share the slides. From Karnataka, Dr. Puttasomappa Shambulingappa, Dr. Satish Kumar Jain from Karnataka, from Maharashtra, Dr. Saroj Narang, Dr. Hemant Adikane, from Odisha, Dr. Gangadhar Rath, from Punjab, Dr. Sanjeev Puri, Dr. Namrata Puri, from Uttar Pradesh, Dr. Ashwini Kumar, and from West Bengal, Dr. Santanu Kumar Bhattacharya. Dear viewers, this year we started with a very big important event on 15th April. Continuing with our trend on 14th August, that is on the occasion of World Pre-Diabetes Day, we are having one more very important event where Dr. Julio Rosenstock, director of Dallas Diabetes Research Center from USA, will address the Indian audience on newer drugs of diabetes. And this session will be moderated by our very own Dr. Sanjay Kalra sir, who is the president-elect of South Asian Federation of Endocrine Societies. So kindly log in and register yourself for this important event on the link provided in the slide. Also, a request from my end, any of your peers who likes to keep updating diabetes, please share this event with them also. As I said, 15th April event, Dr. Vivian Fonseca, the topic was a scientific approach to improving vascular and metabolic health in diabetes. If any of the viewers wants to go through this session again, it is available on the same platform in the archive section. There was one more important event which was conducted last year on 14th November with Dr. Om Ganda addressing on pragmatic approach to choice of glucose lowering therapy. So both these important events are there in the archive section. If any of the viewers wants to go through again, they can rewatch the same. With this, let me hand over the platform to Dr. Kalra sir. Sir, over to you.
Thank you, Rahul, and good evening, everybody. Now, across India, the monsoon has started. There are some parts of the country which are getting perfect rain. There are others which are flooded, and then there are yet others where there is no rain at all. The average may be fine, but the distribution is not fine. And this tells us that water is a very important part of our life. Too much is bad, too little is also bad, and having water that is just right is something that is important. A similar thing happens in diabetes as well. Now, let's just talk about diabetes today and let's talk about water along with diabetes. Have you ever thought that water is a mega nutrient? Just like you have macronutrients like protein, carbohydrates, and fats, and then we have micronutrients like vitamins, minerals, and electrolytes. Water itself is a nutrient. Without water, you cannot be healthy. Have you also thought that water can be a preventive therapy? Water can be a curative therapy. Water can prevent dehydration. Water can cure dehydration. Now that suddenly we begin viewing water as a medicine, then we think more about that. Is it just water, or is it also the solutes and the electrolytes that are contained in water? If water can be a good thing, water can also be bad if it is infected, if it is polluted. It can create waterborne disease. So suddenly now our minds are opening up to the immense potential of water. But still, when we are thinking of this, we'll think of heat exhaustion, dehydration, waterborne diseases, gastroenteritis, cholera. But now let's move on to diabetes and let's see how water impacts diabetes, how diabetes impacts water. Yes, there is an impact. In diabetes, the fluid reabsorption in the kidneys gets altered. Glucose is excreted through the kidneys. This occurs in uncontrolled diabetes. It also occurs with drugs like SGLT2 inhibitors, empagliflozin, dapagliflozin, canagliflozin. And when glucose is being excreted through the urine, it will carry along with it water as well. That is called osmotic diuresis. So increased water loss occurs through the kidneys. This will occur in uncontrolled diabetes and it can precipitate dehydration. A patient who is hypoglycemic, and especially elder patients, they may not feel thirsty enough, or they may not be cognitively strong enough or competent enough to realize that they need to drink water. And they too may develop dehydration. So hyperglycemia can be associated with dehydration. Chronic hyperglycemia can be associated with dehydration. Chronic hypoglycemia can also be associated with dehydration. If someone is dehydrated, that will prevent the person from being able to fight disease as well. Let us look further and let's talk about prevention. Now, when we speak of prevention, we speak of primary, secondary, and tertiary levels. So, primary prevention means preventing diabetes. Can water prevent diabetes? Let's see. Secondary prevention means that the person already has diabetes. Can we help control diabetes by drinking water? The answer is yes, actually. The more water you drink, the more satiety you will feel, the less hungry you will feel, the less calories you will need to take. Also, let us say you're drinking a lot of water and maybe some starchy foods. When it gets mixed up in the stomach, the glycemic index may also come down. And tertiary prevention is the patient has diabetes, the patient has complications, but we want to prevent those complications and we want to prevent them from worsening. Here also, water therapy has an important role. We'll discuss all these aspects and more over the next 10 minutes and then we'll take questions. Now, this beautiful study shows that water intake is associated inversely with new onset hyperglycemia. People who drink more water have less hyperglycemia. People who drink less water and maybe more wine have more chances of developing hyperglycemia. And there is a mechanism for this. This large study was conducted in over 3,600 middle-aged men and women who had normal fasting glucose. And they found that actually drinking more water leads to less chances of developing diabetes. The mechanism that they explained was through vasopressin, through the pituitary gland. So this is the hypophysio-renal axis, the pituitary renal axis. If you drink less water, there will be increased secretion of ADH, anti-diuretic hormone. Anti-diuretic hormone is co-secreted along with a protein known as copeptin. Copeptin potentiates the action of CRH from the hypothalamus, and that leads to increase in ACTH and cortisol secretion. So low water intake leads to increased copeptin, which increases CRH, which increases ACTH, which increases cortisol. And cortisol acts like a counter-regulatory hormone against insulin. It is an insulin, it will promote insulin resistance. Now, when copeptin increases, it also increases both insulin and glucagon. And this leads to increased hepatic gluconeogenesis. Therefore, glucose regulation will be disturbed. In people without diabetes, there will be an increased risk of developing diabetes, 6% more. And in those with diabetes, glucose regulation will worsen. So this aspect of water intake and diabetes is something that we are not aware of. We can counsel our patients to drink more water. Now, you may find this funny. In India, everybody drinks water. But about 20 years ago in France, there was a heat wave. Heat wave definition, 30 to 35 degrees temperature, 33 degrees temperature. And so many people died. They died because they didn't drink water. In France, people at that time, they didn't have fans or ACs. There was never any need for it. And they used to drink wine with their meals. So the public health message that during a heat wave of 30 to 33 degrees, you must drink water, that public health message could not go across throughout the country. And that is why people unnecessarily lost their lives. So it is important, we must tell our patients that water can be used for primary as well as secondary prevention. However, if water deficiency does occur, that is dehydration, then there are many symptoms, many signs, and many issues come into being. Dehydration can be hyperosmolar, uh, hypernatremic, or it can be hyponatremic. It depends upon how much water loss has occurred and how much salt loss has occurred. Different types of complications can be seen in diabetes. In hyperosmolar non-ketotic coma, there will be increased osmolarity, increased glucose levels, increased sodium levels as well usually. And here you will have a different approach. You will have to replace with hypotonic fluids because sodium levels are high. In some other patients, when salt loss also occurs, they will have hyponatremia. There, sodium chloride will be required. This is usually seen in DKA. If you improve the hydration, that is, you give water from outside, it can be oral in some patients, intravenous in others, you will be able to increase the plasma volume. Automatically, because of dilution, plasma glucose will go down. You will also be able to reduce vasopressin secretion. So, copeptin secretion will come down. CRH, ACTH, cortisol secretion will come down. It will become easier to control glucose. Osmolality will come down, and this will directly and also through the reduction in vasopressin, it will reduce gluconeogenesis. That will help in improving glucose levels. Now we are aware of the biochemistry. We understand that the pituitary and hypothalamus works, but let's come to our clinical practice. We all know the contributory factors of dehydration. First of all, drinking less water. Number two, excreting more water, either by vomiting or through diarrhea or through urine or through sweat in strenuous exercise. If the person takes alcohol or has hyperglycemia, that itself will lead to dehydration because of osmotic diuresis. In summer, do not forget heat exhaustion, which is a very common cause in OPD. In OPD, even now, because it is quite hot here in Karnal, even now and for the past 2-3 months, when patients come in with fatigue, easy fatigability, my first diagnosis usually is heat exhaustion, dehydration, dyselectrolytemia. And many times we just tell our patients to sit down, maybe have an energy drink like an Erzal Zero, and then see what happens. Diabetes insipidus is something else. So do not forget two conditions, diabetes insipidus and psychogenic polydipsia. How will you pick up dehydration? Patients will complain of being thirsty all the time, having a headache, dry mouth and dry eyes, dark yellow colored urine, dizziness, and easy fatigability. When your patients say they are always thirsty, they are drinking, how I explain to them is maybe you are thirsty because there is less sodium in you. You keep on drinking water in the fields, but you forget to replenish the salt. And the headache is because your head is actually trying to send you a message that I don't want only water, I want water with electrolytes. I want an energy drink. And the tiredness is because the electrolytes are less. So there's no petrol, no fuel to run the engines of the muscles. So this is how we explain the concept of electrolyte replenishment to our patients. We tell our patients also, if you have the farmers, they have animals, they have domestic animals, and in summer it is common practice here to give huge slabs of rock salt to the animals, so the animals can keep on licking as much salt as they want. So what we tell them is, you're taking such good care of your domestic animals, but not of yourself, so don't forget to replenish salt. If you don't do this, and then the patient goes into severe dehydration, you might get hypotension, a feeling of confusion, the eyes will be sunken, pulse will go up, the pulse will become weak as well, patient will become lethargic. And in spite of a hot ambient environment, you will find that the axillae are dry. The axillae will not have any sweat. That is one way of noticing severe dehydration. Do remember that dehydration should not be viewed only as a water disorder. It will also be associated with electrolyte disorders. So think of sodium, potassium, magnesium, and calcium. In the OPD, like I said, in summer, you do tell them to replenish all the electrolytes. And when you're taking an energy drink, see that the electrolytes are there in balance. Uh, Along with hyperglycemia, usually we have hypernatremia. This is in hyperosmolar coma. In patients with hypoglycemia, there may be hyponatremia. However, uncontrolled diabetes per se can also lead to hyponatremia because of osmotic diuresis. There will be no coma, but the patient will be just tired. Patient will be tired. And when you are managing in the indoor, do remember to do a corrected sodium calculation. Corrected sodium is equal to measured sodium plus 1.6 multiplied by the glucose minus 100, all put together divided by 100. So corrected sodium is something that you must always calculate. Hypocalcemia doesn't occur very common, but if you have a patient with tetany, think of both hypocalcemia and hypomagnesemia. Hypercalcemia is also not common, but if you do have hypercalcemia, that can lead to insulin resistance. And hypophosphatemia, again, something that we tend to miss quite often. This will be seen in patients with Graves' disease, vitamin D deficiency, and high diuretic use, as well as malabsorption. So now what we have tried to do today is to open our minds to the role of water in diabetes. Water and diabetes have so many interactions with each other. But from our point of view, in the OPD, we should be encouraging everybody to drink adequate water and take adequate electrolytes, especially during summer months. We should view water as a mega nutrient, as a means of preventing diabetes, preventing worsening of diabetes, preventing complications of diabetes. We should also view water as a therapeutic tool to improve glucose control and to help correct the complications of diabetes in a faster manner. But let us see what the correct statement is in today's quiz. One of the following is correct. So which is it? Is it A, low water intake has no effect on the secretion of ADH? Or is it B, drinking water may lead to 6% less chance of having type 2 diabetes? Or perhaps C, reduced glucose intake is not linked to glucose regulation? Or maybe D, low water intake suppresses CRH action? So let me repeat, one of these is correct. Low water intake has no effect on ADH secretion. Drinking water reduces the chances of having type 2 diabetes by 6%. Reduced glucose intake is not linked to glucose regulation. And low water intake suppresses CRH action. Now we've had the quiz. Let us see our questions for today. And I'd like to thank Dr. Ajay Kumar Lal. Thank you, sir, for your comments, and also Dr. Manoj Yadav as well. Thank you, Dr. Gauri Shankar Dharmaraj as well. Thank you for being with us. So now many questions, few out of syllabus also. What is the drug for painful erection? Otherwise normal libido and everything. There has to be a reason. It will probably be a neuropathy. So some of the drugs that you should not use will be trazodone, because that will worsen it. But you can use pregabalin, and sometimes off-label you can use carbamazepine for this. Pregabalin is the one I would suggest first. For nocturia, we have to find the reason. It can be prostate, it can be urinary tract infection. These will be the two common ones. Other common one might be diabetes insipidus, and of course diabetes mellitus is there. But the two things we should rule out will be urinary tract infection and benign prostatic hypertrophy. For sleep in diabetes, yes, we can classify sleep-related drugs as being benzodiazepines and non-benzodiazepines. Benzodiazepines are cheap, easy to use, but they are associated with addictive potential. So you can use clonazepam, alprazolam, or etizolam. Clonazepam, etizolam are available as sublingual tablets, very easy to use. Clonazepam is the cheapest. But it would be better to use a non-benzodiazepine drug. The drug of choice would be lemborexant and zolpidem. Both are available as 5 and 10 milligram. Lemborexant actually will help improve not only the quality of sleep, but also glucose control the next morning. Sometimes sleep quality may be disturbed because of obstructive sleep apnea. So it would be a good idea to take a history of obstructive sleep apnea. There is something known as the stop bang questionnaire, which you can use to screen for sleep apnea. Stop bang, now let me see if I remember all of it. S would be for snoring, T would be tiredness, O is you observe spells of apnea, and P, now I've forgotten, maybe someone can help us out. Bang, B for body mass index high, A for now again A also I've forgotten. N is for neck circumference, and G is for glucose, I think. So, but this stop bang, it's easy to do actually. 4 symptoms and 4 signs are there. If patient has obstructive sleep apnea, then you have to manage that. That will help improve sleep and diabetes also. We have other questions also coming up. From Dr. DG Parmar, how accurate and reliable are the digital BP apparatus for diagnosing and monitoring hypertension? They are quite accurate and reliable now, sir. Use a good company, one that checks blood pressure in over the arm. And if you do it in the proper method, you can actually rely on it. The home-based BP monitoring might be more accurate than the hospital monitoring. So there is a question from Dr. Gangadhar Rath. Is sugar needed for the absorption of electrolytes from the GIT? No, not necessary. And then, okay, Dr. Gangadhar Rath goes on to say, if yes, so it's not necessary, but if yes, how can Enerzal Zero without sugar be effective? Okay, so there are different methods of absorption of electrolytes. Let us talk about sodium. Sodium can be absorbed by co-transport with glucose, but it can also be absorbed by co-transport with amino acids and then by co-transport with hydrogen. So amino acids, glucose and hydrogen, all of them will move sodium from the GIT into the blood. Suppose glucose is not available, then the others will also work. Now, if you're giving Enerzal Zero, other things are already there. If the patient's glucose is low, then we will give Enerzal or Enerzal Blitz. If the patient's ambient glucose is high, the patient is diabetic, only then we are going to give Enerzal Zero. So we assume there is enough glucose in the blood already. The absorbed sodium from the gut, that actually crosses the intestinal barrier through these sodium pumps. And like I said, the sodium pump can be with hydrogen. It can also be a co-transport with sodium. It can be a co-transport with amino acids. But this absorbed sodium, when it gets pumped into the blood, it reaches it actually reaches the intercellular areas, and it allows water also to diffuse along with it. So we really don't need to worry, and the sodium as well as water both will enter the circulation. But that is a good question, Dr. Gangadhar, and thank you for that. Even when you are looking at the kidney and when you see the SGLT2, so there is a sodium glucose transporter, but SGLT2 1, SGLT2 are there, but there are other pathways as well. Even in the kidney, there is a sodium hydrogen pump. Dr. Ajay was not able to hear the audio, so I apologize for that. Let me just repeat what I have said, that sodium can be transported across the gut along with glucose, along with amino acids, and as part of the hydrogen pump. So any one of these will work. It would be nice if we could just share our opinions. How much water do you drink every day as an individual? So that's my question. How much water did you drink today? How many glasses, how many liters? Did you count or not? What time of the day did you drink water? Was it regular throughout the day? At the end of the OPD, did you feel dehydrated? Was your tongue thirsty, tongue dry? Were you thirsty? Were you tired? Were you irritated? If yes, that means we just need to drink water more frequently. I myself am guilty. Sometimes it is a long OPD and I forget to drink water, and then I get tired and irritated by the end. So my patients' children now, they are growing up. They keep on reminding me that, sir, you must drink water after every few patients. And I'd like to thank Mr. Lalit Kathuria from Sonipat, who keeps on reminding me regularly to drink water every hour. So with that, there are no more questions, but I'd like to thank everybody for being with us today. And I'd like to hand over to Team FDC for their final comments.
So thank you very much for taking up a very important session, which is mostly ignored because we take water as in granted. And that's the session we wanted actually from the top of the pyramid from endocrinologist of the stature of Dr. Sanjay Kalra. I'm sure that tomorrow onwards, all our general physicians and MD physicians will start taking this, the nuggets of this today's lecture and take, obviously, it won't be, replacing the medicines, but at the same time, obviously, increasing water intake in India can prevent as well as kind of delay the onset of new onset of diabetes. With this, I thank Dr. Sanjay Kalia for taking this session. Jai Hind, sir.
Jai Hind.